As part of his phase 1 reopening, Governor DeSantis announced elective surgeries can now resume.
Leaders at AdventHealth agree it's a safe time to reopen, but there will be some changes. Here's News 6's Mark Lehman with more.
With Florida's reopening going into effect on Monday, leaders here at AdventHealth say things are now much different for healthcare workers, patients, and visitors being allowed to return. And these are changes that could be long-term in many cases.
We believe it is a safe time to reopen with the right steps and the right actions.
President and CEO Daryl Toll says those actions involve sweeping changes across AdventHealth. One of the most noticeable will be temperature checks and universal masking, meaning everyone inside their facilities must cover their nose and mouth with masks that will be provided.
So we believe as long as that 1 to 2% exists in the population and that we have asymptomatic carriers of this, that we need to have the masking until proven otherwise.
With the possibility of carriers with no symptoms, every healthcare worker and hospital patient will also be tested for COVID-19.
We want to do a test. We want to understand if that individual has any kind of positive result.
One visitor per patient is also now being allowed. Those entering the waiting room will see signs and chair covers to encourage social distancing. Virtual check-in is also an option. As for elective surgeries set to resume on Monday, AdventHealth says with many cancellations over the last 8 weeks, the most needed procedures will be scheduled first.
And to prioritize those cases first and eventually get back to our purely elective cases.
Now, one point doctors want to emphasize is that the goal of all this is creating a safe environment. They're hoping the new policies will put minds at ease, and they're stressing anyone that has health care needs should have those needs addressed as soon as possible. In Orlando, Mark Lehman, Getting Results, News 6.